Hey guys, and welcome back to my channel. If this is not your first time, but if this is your first time, hello, how are you? My name is Dr. Antonia. You can call me Dr. A. I'm a holistic healthcare practitioner, a psychotherapist. I believe that the health of the mind, the body, and the soul should be one for a person to be truly healthy. So I bring you tips and tricks to maintain a healthy body, healthy mind, healthy spirit, to also help you improve your lifestyle and a sprinkle of my life. So if you're interested, go ahead and subscribe and I'll see you in my videos. Today's video is going to be focused on male fertility and it's going to be divided into 3 parts. The first part will focus on medical issues that cause infertility. The second will be lifestyle things that you do in your daily life that is deteriorating your chances of fertility or causing infertility. And the third will be things you can do to boost fertility. So make sure you stick around for all 3 parts. Leave your comments, leave your questions, and I'll be sure to answer them as I see them. Subscribe, guys, subscribe. So, what are some medical conditions that can cause or are leading to infertility? Before I begin, there are 3 major things that can cause infertility in men. The first one is the quality of the sperm. The second is the quantity of the sperm. And the third is blockage in the reproductive organs responsible for reproduction. These 3 major things would always lead to infertility or would always be a cause of infertility. So the things I'll be discussing are things that can affect these 3 major aspects. The first is going to be something called varicocele. This is the swelling in the veins of the testis and the scrotum. What happens is, maybe due to impact, infection, or whatever, the veins in the scrotum and the testis swell. When you are doing a self-examination, it usually feels like a bag of worms. Please do not ignore this because this can cause decrease in the blood flow to the testis, which in return can affect the quality and quantity of sperm. Secondly, infections. If you are conversant in my videos, you know how I hammer on not ignoring the signs of infections. When you have temperature, when you have chills, when you have discharge, when you have pain, when you have sores, do not ignore these because you may think, oh, it's going to go away, but instead it's actually going upward and affecting major organs responsible for fertility. And you may not know it now if you're not trying to have a child or if that's not in your plan, but then later you may realize, oh, these infections have already caused major harm. So it's always better to tackle infections once they come. Get the right treatment. Don't go over the counter and just take any medication because you don't know if it's viral, fungal, bacterial, and it's very important that you're tested and given the right medication to treat that infection. Thirdly, erectile dysfunction. If there's erectile dysfunction, there's a problem with intercourse, there's a problem with fertility because you need intercourse for fertility to take place. If there's an erectile dysfunction, there are other options you have, but it's better to treat or figure out why. Erectile dysfunction can not just be physiological, it can also be psychological. So sometimes it's not even about anything wrong with you. It's in your mind. It's something mental going on. So it's important to seek help if you're experiencing erectile dysfunction. The fourth thing is something called retrograde ejaculation. Now, usually when ejaculation takes place, sperm comes out. But with retrograde ejaculation, sperm goes back and enters into the bladder. This can be caused by various things, maybe some medications you're taking, past surgeries that have caused adhesions to form in the body. Infections can cause it also. Some chemicals that you're being exposed to can also cause retrograde ejaculation, like lead and so on and so forth. So if you notice that you have an orgasm, but there's nothing coming out, but you feel like you ejaculated, and you're seeing sperm in your urine a lot, ensure that you see a healthcare professional so that you can be tested to see if you are experiencing retrograde ejaculation. The last thing I'm going to be talking about is something called undescended testis, and this usually happens when a man is a baby. An undescended testis is meaning that the testis did not come from the abdomen and descend into the scrotum. This could happen when a child is between the ages of 0 to 1. It is important that if you have a child and he's a male, ensure that you examine the scrotum to make sure that there are two ball-like things inside. If not, see a doctor, see a pediatrician. Usually, testicular examination is one of the examinations done for male children. But just in case maybe the medical professionals missed it, as a parent, ensure that you examine. And even if you go home with a child whose testis has not descended yet, weekly examine to see if it will descend, because after 1 year, you would need surgical intervention. The body temperature is too hot for the testis to survive. So, or for it to be able to thrive, it needs to come down to the scrotum where the temperature is cooler and helps it produce quality and a right quantity of sperm. So, as a parent, please ensure that you're very sensitive to your male children and ensure that their testes are in the scrotum by doing examination for them when they are infants, because when they're adults, then the testes may not be viable anymore, and of course that means good sperm or even quantity of sperm is a no-no for them. All right, so stick around for part 2. Don't forget to like, to share, to subscribe, and leave your comments and your questions, and I'll be sure to answer them. Thank you. Bye.